Rafich here from Vet Triage. We are going through this October 2024 edition of Veterinary Surgery, and we're going to be talking about a surgical report, short-term outcomes of dogs and cats undergoing lung lobectomy using either a self-ligating loop or a thoracoabdominal stapler. And for those who are not familiar with the anatomy of a dog's lungs, there's some anatomy for you there at the bottom. This study comes out of two private practices, one in New Jersey, one in Maryland. Northstar VETS in New Jersey and Apext Vets in Maryland, and then Cornell University in Ithaca, New York. The objective is to assess clinical outcomes of lung lobectomies in dogs and cats using either self-ligating loops or thoracoabdominal staplers, aiming to inform sample size calculations for future superiority trials. Now, right away, I have a problem with this, and you'll see this more as we go through this study. They already know that the sample size here is small, and they are predicting what it would take for future studies to be able to make more determinations. There are papers that are better than that, structured better than this one is, that get published, or they get declined rather, because they don't have adequate samples, not enough detail, and yet, sometimes these papers get through, and I wonder how much of it is political. It's already frustrating, but regardless, these papers do offer some level of positive contribution to the field. It's just I question sometimes how these journals pick and review their articles. Okay. Anyway, it's a retrospective study, 72 dogs, 15 cats. The study goes from 2003 to 2023. They had a minimum of a 14-day postoperative follow-up period. The results were 101 lung lobectomies. The thoracoabdominal stapler was used in 82.2% of cases. The remaining 17.8% had the self-ligating loops. Intraoperative complications were seen in 13.9% of surgeries. They include intraoperative hemorrhage at 11.8% and air leakage in 1.9%. Post-op complications were identified in 13.8% of cases. Those that had catastrophic complications were 4.6%. Major complications, 5.8%. All intra and post-op complications occurred in cases that underwent the stapled lung lobectomy. However, there were no differences identified between surgical technique and either intra or post-op complications. A sample size of 103 lobectomies per technique would be required for appropriate evaluation. There you have it. Which is crazy because they're saying that all the complications happened with a single surgical technique that they used here, but yet they can't determine that that technique is worse because there's not enough cases. So I just feel, and not to mention this is over a 20-year period of time. So in over 20 years, 101 lung lobectomies. It just seems like they could have waited longer or just picked another disease or had a different angle for this paper. But I'll stop. Okay, introduction. Total or partial lung lobectomies in dogs and cats are commonly performed for neoplasia, ruptured bulla or blebs, spontaneous pneumothorax, lung lobe torsions, abscesses, or foreign bodies. Surgeries have involved vessel sealing, bronchus suture ligation and oversew, partial and total stapled lung lobectomy, partial lung lobectomy via hemostatic suture placement, or partial lung lobectomy via vessel sealing device, or total lung lobectomy via an en-bloc ligation or lung biopsy using self-ligating loops. Commercially available self-ligating loops consist of pre-tied suture loops with self-ligating knots encased within a plastic knot-pushing tubing device. Self-ligating loops have been assessed as safe and effective in human and veterinary studies for hepatic and pulmonary surgeries. Researchers have demonstrated that self-ligating loops may provide advantage over stapling devices in ex vivo studies, showing improved leakage profiles for both airway and vascular ligation in various comparisons. Furthermore, another study reported no intra or post-op complications with 6-month follow-up in a small case series of self-ligating loop lung lobectomies. Materials and methods. Some surgeries had both methods used. For data acquisition, these cases had thoracic radiographs and or thoracic computed tomography. Recorded complications were defined as adverse events that occurred following surgery with a minimum of 14-day follow-up according to the Cook classification system based on physical exams or email correspondence. Minor complications were those that did not require medical or surgical intervention. Major required pharmacologic or surgical intervention. Catastrophic were those that caused permanent unacceptable function, potentially directly contributing to death or necessitating euthanasia. Regarding procedure description, the thoracoabdominal stapler, the staple line encompassed an individual hilus, including the bronchus, artery, and vein without separation. The lobe was excised distal to the staples, using the stapler as a cutting guide. In the total lung lobectomy with the self-ligating loops, 2 self-ligating loops were placed around an individual lung lobe and tightened around the hilus, including the bronchus, artery, vein without separation. Following loop tightening, the lung was excised 5 to 10 millimeters distal to the ligatures. Results: 54% of dogs were male, 45.8% female, 44.4% mixed breed. Median age of dogs 10 years. Median weight of dogs 26.3 kilograms. Cats were mostly domestic short hair. Most cats were female spayed. Mean age 9.8 years and mean weight of 4.8 kilograms. Cases had CT with plus or minus thoracic radiographs in 93.1%. Radiographs alone in 6.9%. The surgical approach included lateral thoracotomy in 83.9%, median sternotomy in 13.8%, and thoracoscopy in 2.3%. A total lung lobectomy was performed in 91.1%. Thoracoabdominal staplers used in 80.5% of cases. 11 were cats, and 83 lung lobectomies, which is 82.8% overall. A thoracoabdominal 30 V3 stapler was used in 88% of cases. More than one staple cartilage was required in 13.2% of cases. Self-ligating loops was used in 19.5%. 4 were cats, and 17.8% of all lung lobectomies. All self-ligating loops were performed after 2020. No difference was noted between the loops and the species, age, or weight. Okay, regarding outcome data, intra-op complications occurred in 13.9% of lung lobectomies. All intraoperative complications occurred with the stapled lung lobectomies. Intra-op hemorrhage was 11.8%. Leak test failure, 2%. There was no difference in intraoperative complications between stapler or loops. And again, that's dumb considering all the complications happen with staples. But like they said, statistically speaking, they can't prove that. No other variables were found to be associated with complications intraoperatively. Post-op complications, 13.8%. All those complications occurred with stapled lung lobectomies. They were characterized as catastrophic in 4.6% and major in 5.8%, minor in 3.4%. No differences were found. All cases underwent intra-op chest tube placement. Median duration of chest tube was 1 day, which is crazy to me. My experience, usually 2 to 3 days, I would say, but 1 day is wild. And median duration of hospitalization, 2 days. I kept these animals in the hospital at least 3, probably 4 to 5 days typically. 94.3% survived to discharge. There were no associations there either. Median follow-up duration was 76 days. Common histopath include carcinoma in 54%, bulla in 10.3%, torsion in 10.3%, pneumonia 5.8%. Which is interesting. They actually didn't mention pneumonia as an indication for lung lobectomy in their introduction. Regarding sample size, assuming a 16.9% intra-op complication rate for stapled and 5% for loop, a sample size of 103 lobectomies per technique would be required to appropriately evaluate. All right, discussion. Their focus was not on establishing technique superiority, but on reporting complication rates to inform future study designs. Intra-op complications secondary to occlusion failure was seen in 13.9%, which surpassed that of human studies, 1.19%, and veterinary studies at 6.7%. When compared to an endoscopic stapling device, self-ligating loop lung lobectomies have a higher airway leakage pressure of 40 centimeters of water versus 28 centimeters of water for patients undergoing lung lobectomy 3 centimeters from the pulmonary edge. When comparing the thoracoabdominal stapler to the loops, only the staple ligations had airway leakage less than 80 millimeters of mercury, with one stapled ligation leakage occurring at a physiological pressure of 5 millimeters of mercury. The loops improved resistance to airway leakage, likely correlating with improved resistance to hemorrhage. This is supported by the results of an in situ pulsatile perfusion partial hepatectomy model, where greater time until hemorrhage and less leakage overall was observed with the loops compared with the stapler. This prior research may lend support as to why our population exhibited a higher intraop hemorrhage compared to airway leakage, considering that the median arterial pressure of most dogs and cats undergoing lung lobectomy exceeds physiologic airway pressures. Vascular or bronchial occlusion security is likely most influenced by surgical technique. The complications observed in this study were considered non-specific to the type of lung lobectomy performed. Finally, the use of loops may potentially offer an incisional size benefit, as observed in human pediatric patients. Unlike the endo-GIA, which requires a 12 millimeter port, the loops can be utilized with a 5 millimeter port. Furthermore, the loop costs 1/4 to 1/16 of that of the stapling equipment. So my issues with this study, as I mentioned, they said that lung lobectomy is a common procedure. I would argue with 100 cases over 20 years, it's not that commonly performed. It would be nice to have a large number of cases, which they mentioned, of course. It'd be great if they differentiated the difference between the biopsies between dogs and cats, especially, although they may have done that in supplemental materials for the study. I'm just missing it. And they did not comment on collecting a culture when they submitted the lungs. So typically we'll not always. I mean, it's not a rule, but it's nice to submit a culture with the lung biopsy to make sure if you are dealing with pneumonia or an abscess or something like that you know what bacteria might be there, and you also can treat accordingly based on the antimicrobial sensitivity testing. All right, thanks guys for joining, and subscribe and sharing and all that, and we'll see you again tomorrow. Bye.